Here we'll talk about acute flaccid paralysis and the causes of it. So from the word acute, you have to remember the onset is less than 15 days. And from the word flaccid, flaccid means absence of spasticity or any upper motor neuron signs. And the paralysis, it means rapid onset weakness or paralysis of limbs, right? So this acute flaccid paralysis is a lower motor neuron lesion, which is causing this absence of spasticity or rapid onset weakness in the limbs within 15 days of onset. That is acute flaccid paralysis. According to the Global Polio Eradication Initiative, they have given some other definition for this acute flaccid paralysis. So let us see that. So any case of flaccid weakness in the children less than 15-year-old or any paralytic illness at any age when the polio is suspected is called as acute flaccid paralysis. So any case of flaccid weakness in the children less than 15 years of age or any paralytic illness at any age when the polio is suspected is acute flaccid paralysis according to the Global Polio Eradication Initiative. And you can remember all the different differential diagnoses for this acute flaccid paralysis by this mnemonic: pigs love bad pumps and also get infections and trauma from it, right? So pigs love bad pumps and get infections and trauma from it. From the word pigs, you can remember poliomyelitis, inflammatory myopathy, Guillain-Barré syndrome, snake bite, right? And from the word love, you have to remember lead and arsenic toxin poisoning can also lead this acute flaccid paralysis, organophosphorus poisoning, vasculitis, Eden-Lambert syndrome, right? And now coming to the next word, which is bad. So from the word bad, you have to remember Bell's palsy, acute transverse myelitis, diphtheria. So post-diphtheric neuropathy is also a cause of acute flaccid paralysis. Pigs love bad pumps. From the word pumps, you can remember periodic paralysis. And from the letter U, you can remember botulism. And M stands for myasthenia gravis, P again stands for porphyrias, and S stands for spinal cord compression. And along with that, pigs love bad pumps and they get infections and traumas. So these infections can also cause this acute flaccid paralysis, and any trauma to the spinal cord or traumatic neuritis can also be a cause of acute flaccid paralysis. So these are the different differential diagnoses for acute flaccid paralysis, which you can remember by this mnemonic: pigs love bad pumps and get infection and trauma. Right? So this is about the causes, and let us see the clinical symptoms of acute flaccid paralysis. One thing is you can see sudden onset weakness. So sudden onset weakness and paralysis with the decreased muscle tone and absence of deep tendon reflexes, facial palsies and facial weakness, and abnormal gait can also be found. So these are the different clinical symptoms. So in case of proximal muscle weakness, you can see Gover's sign, and in case of distal muscle weakness, you can see the person stumbling or falling. Right? And the diagnosis, you can do it by MRI, nerve conduction velocity, EMG, repetitive nerve stimulation and all. So this is about it. Again, the mnemonic is pigs love bad pumps and get infections and traumas. So this is about it. Bye.